Hi, this is Dr. Ty Vincent. This LDI video is about dose reporting. This is one of the most important videos to watch. You may have to watch it more than once. I will try to be fairly concise and give you the most important information about this. The decisions that I make for you about what doses to take after whatever you just took, they hinge entirely on your dose reports. So every dose you take, you're gonna have to send me this report about what you took, when you took it, and how it seemed to work. And based on that information, we will decide what you take next. Because with LDI, there's no plan beyond one dose at a time. We know what dose you're gonna take first or next, and then that is its own isolated science experiment. And based on the results of that experiment, we decide whether you go on to a stronger dilution, whether you repeat that same dose, or maybe if it sounded like it was too strong, if we want to back up and give you a weaker dilution to try next time. So the dose reports are your job, your homework. That's how this relationship works best. You observe and report to the best of your ability what you think each dose does. I catalog all the information. I keep track of how people respond to each dose in a flow sheet. And then I look at it from my perspective and objective viewpoint and decide which way we should go. If we both follow that guideline and we stick to our lane and we each do our job to the best of our ability, we get the best outcome. So with dose reporting, there are two things that you can tell me that are factual and concrete and should have no ambiguity. One is the date that you took your dose. This is really, really critical. I harped on this a lot in the past. I want a calendar date. So like July 28th or October 3rd. What I cannot interpret accurately necessarily is weekdays. So Monday, Tuesday, Sunday. Try never to tell me a weekday if you can help it, because it's ambiguous. There are 52 or even 53 Wednesdays per year, and I am not always sure which one you're talking about. Try not to give vague numbers of days ago, like I took my dose 6 days ago, 7 days ago, a week ago, or I took it last week. That's a pet peeve of mine because it could be interpreted a variety of different dates, and the date you take your dose is actually really important. So just mark it on a calendar, record it somewhere, always tell me the calendar date that you took your dose. I also want to know the dose that you took. The doses are going to be written on the invoice you get with each syringe. There should be a label on the syringe itself. It tells you which one it is. So even though I should know which one you should be taking, I want you to confirm and verify for me every time which dose you took so that there's no mistake. Sometimes people take the wrong syringe by mistake. Sometimes we send people a series of dilutions and they start at the wrong end. And so I'm not going to assume that I know which dose you took. I'm going to rely upon you to always verify for me which dose you took so there are no mistakes made in your care. So those two things can be concrete and objective and non-ambiguous. The rest of it is hazy. So after you tell me those things, I'm gonna wanna know how the dose worked. And so people will often say, well, what am I looking for? And in general, all the reasons you got a hold of me in the first place, whatever your symptoms are, whatever your problems are, we want those to go away. Like that's the gist of it. Like if you have chronic joint pain, we want your joint pain to go away completely. If you have a rash, we want your rash to go away. If you have diarrhea, we want your diarrhea to stop. If you have a food allergy, like every time you eat peanuts, your mouth itches and you get hives, we want to see that you could eat a peanut and those things didn't happen. So the biggest part of your report that is subjective and potentially confusing is going to be what happened with the dose. In one sense, what I want to know first is a very binary black and white. Did it completely work? Like, did you get 100% success or not? So that should be pretty clear depending on your symptoms, or if you have an allergy, you may have to do a test exposure. And that's something we'll talk about with allergies later. But whatever you have to do to determine if your dose worked, whether you're just watching chronic symptoms like chronic pain or fatigue or a rash or bowel problems, I want to know whether during the course of that week, because you're going to report to me a week after the dose, did the problems stop? And if they didn't, then we're going to end up going to a stronger dilution probably, because we're going to keep going until we do find a dose where those problems stop. If you have an allergy and you need to do a test exposure, then at 6 or 7 days after your LDI dose, you're going to do your test exposures, whether it's to an animal or grass or some kind of food you need to eat or a chemical exposure. Whatever it is we're testing, whatever antigens we're treating you for, you'll have to do a test exposure. And then what I want to know is, did you still have a reaction? Or was there no reaction? Because what we're looking for is no reaction. So the first thing is like, I look for this black and white. Did it work perfectly or did it not? If it did not work perfectly, I want to know, did it make you worse? So it's possible if we overdose people with the antigen dilutions that your symptoms or your reactions to things could actually get worse. We'll talk about what that looks like in another video. So a flare response is when we overdose you. And I'll give you more details about what a true flare looks like afterwards. But I'm gonna wanna know if you think it made you worse. And if you do, I want some estimate of how much worse. My symptoms were 30% worse, 80% worse. Just, I know it's ambiguous and it's subjective, but give me something so that then every time we have a report, I have something to compare it to in sequence. That's really key as we go through a series of doses. Similarly, if you think you have partial improvement but not complete improvement, I want some kind of estimate of how much improvement you think you got. 50% better, like my rash was 80% gone, or my headache was better, maybe 75% better. Give me some kind of estimate. And it doesn't have to be perfect because there's no way to measure most of these things, but I'm gonna use them as a tracking method to compare one dose to another over a period of time. That's when it becomes useful. So the date, the dose, and whether it worked or not, to what extent it may have worked. If you do have what seems like a perfect response, like no reactions to your allergens or your symptoms go away completely, I still want you to report at 1 week, but then what I'm gonna tell you is, I want you to let me know now when your symptoms come back, because LDI works temporarily. So even if it works 100% perfectly, that'll wear off at some point. And so the next thing, if we do get a dramatic good response, keep in mind that the next thing I'll want to know is how long that lasts, because that duration of effect is the next factor we use in deciding what dose to take next and when. So keep that in mind. And one of the things I would say also is don't overthink it. The more people write in their email, so the longer your dose reporting email is, the more likely nothing happened. Because people are trying really hard to convince themselves that something happened, and then by extension convince me that something may have happened, or they're telling a really long, complicated story and hoping that I can decide whether something happened or not. What it will tell you is that when LDI works, there's no real confusion. It's very clear, it's very obvious, it's very dramatic. So if you're not sure that it had an effect, then it didn't. And when people start their long emails by saying, I'm not really sure what happened, honestly, I don't read the rest of the email, because that means nothing happened. So don't spend a lot of time trying to tease out some minor change this way or that. You're looking for something really, truly dramatic. If you think it was a negative effect, it needs to be way more outside your range of experience than what you normally see on your worst days, for example. And we'll talk about that with the flare video. So I want to know, like, succinctly as possible, if you can tell me whether it really worked, to what degree it may have worked, how long it may have lasted. Those are things I really want to know. You do not have to delineate all your symptoms again, because I have them in the initial consult. You don't have to describe your symptoms to me. One of the common things people do is they will give me a description of their symptoms, but they will not tell me whether they were worse or better or the same. So if you're going to talk about your symptoms, I need some kind of relative gauge. I need to understand relative change in your symptoms. So if you just tell me, I took my dose and I had a headache all week, but I know you have headaches anyway. So what I want to know is, was your headache better than usual? Was it worse than usual? Or was it the same as usual? I need one of those modifying words for me to make any sense out of your report. So that's a common thing. People will just give me very extensive descriptions of their symptoms, and that's actually not helpful. So try to avoid that. Say, my rash was better, or my rash was worse, or my rash was about the same. I need one of those things to qualify whether it changed or not.